Hey everyone, and welcome back to the Mental Health Collective. This is a channel where we talk about mental health topics that mean the most to families, teens, and children. Today, we are going to have a very important conversation, and I think you'll be very grateful for the topics and the things that we're going to go over. And that is how to start a conversation with your child or teen about mental health in general, anxiety, depression, anything. So I'm going to give you practical steps in this video to take. I'm going to give you phrases to use and what not to use. And we're going to dive deep into the world of how you can prevent coming off awkward as a parent, but more as just somebody in their corner, their cheerleader, their support person. So we're going to go over all of that today, and I'm super excited because this is probably one of the most least asked questions, because by the time they get to my office, they have already been through all that. But I found it very important for me to share information on how to start this conversation with your child, because I'm not gonna lie, it could be intimidating. It could be very intimidating. And so I'm here to help you through this process. If you ever felt unsure about how you can approach these sensitive topics, you are not alone. Okay, so grab a cup of tea, a cup of coffee, whatever your jam is, and let's dive deep into this topic. So before we get into how to start these conversations, we first need to acknowledge why these conversations are important. Mental health topics like depression and anxiety are more common than what you probably realize. 1 in 5 kids or teens will experience a mental health challenge during their developmental stages. So it's very important that you know how to bring up these topics to your children. Why bring up these topics to your children? So talking openly about these things reduces the stigma, which we are still on a mission to eradicate. That's been around since our great grandparents and probably before then. So we definitely want to eradicate the stigma and reduce the stigma as much as possible. We want to give that gift to the next generation. And it helps your child feel safe, that they can share their feelings with you. And early intervention in having these conversations early on is good to redirect the minuscule problems from turning into bigger ones. I'm pretty sure if you haven't already, and I hate to put this idea in your head, but the suicide numbers are climbing every year since 2020. It's at a astronomical high, and there's way more kids and adults completing suicide now than what we would ever want it to be. One is one too many, but I'm talking about over the thousands in 2025. So we definitely need to be having these conversations with our children, with our friends, with anybody that we love and care about. Make sure you're checking in. But as a parent, you play a vital role in your child's life, and you're creating a space where your child feels heard and supported. But having a conversation about mental health requires preparation. You just can't go into this thing all willy-nilly. And you can't come off cringy. You have to know how to start the conversation in a way that could be well received. So here are 3 things you can do to prepare for your conversation with your kid. Number 1, you need to educate yourself. You need to learn about the signs and symptoms of depression, anxiety, so that you can recognize them in your child. So when you're having a conversation, you can say things like, I've noticed that you've been more isolated lately, or you've been in your room more often than not. You're not interested in XYZ, which usually, you are. So if you need to talk, I'm here. For example, withdrawal, isolation, irritability, sadness, or changes in appetite or sleep are dead giveaways for issues with mental health or the start of a mental health challenge. Or number 2, would choose the right time and place to have the conversation. There's a time and a place for all things. Please do not pick a high stress conversation or argument to start to have this check-in with your child. Maybe pick a car ride where they're not doing anything. Pick something where you're evenly balanced and so are they. Nothing is high stress. You're not saying things you don't mean or coming off a certain way to them in particular. They don't already have a perceived notion of you in a negative light, like y'all are just driving in the car. Pick a calm, private moment where there's no TVs, there's no phones, cameras, none of that around. And number 3, please be ready for resistance. Your child might not want to have this conversation with you right away, and that's okay. Give them the space and opportunity to let it digest, for them to process what you said, and for them to talk themselves into letting themselves know, number 1, it's okay to talk to mom and they or dad. They mentioned that they'll always be here for me. Let's try this out. Let's see where it goes. Because how they perceive the conversation to go will open the door for more conversations to be had like that. So make sure that you have an open door policy and they feel comfortable enough and you don't push them right off the bat to have the conversation. Sometimes it's just planting that seed for ongoing communication so your child knows this is a safe place. My mom, my dad, my parent, my guardian is a safe option for me to be myself, to express myself, to open up and let someone know what's going on and how I'm feeling. So remember, your goal is to not fix everything that they bring up in the conversation. It's to plant the seed again for ongoing dialogue. Now let's talk about how to actually start the conversation. The way you frame this conversation matters. Instead of accusing or lecturing your child, focus on being empathetic and knowledgeable. Focus on being their supporter, their cheerleader, being in their corner. Being non-judgmental, that's definitely key. Here are a few examples that you can use to start your conversation. Hey, Johnny, I've noticed you've seemed a little quieter lately than usual. Is there anything you would like to talk about? That's it. Or you could just make a statement like, I know life can get hard sometimes and we all go through ups and downs. Some things we feel like talking about, some things we don't. But if you ever want to talk about anything, I'm here to listen. Or you could go about starting a conversation in this way. Sometimes people feel sad or worried, and that's okay. That's totally normal. And if you ever feel that way, I want you to know you can always talk to me. That's it. Notice these examples that I've shared with you are not you statements, but I statements. I've noticed sometimes something very general so they don't feel judged or singled out by you as their parent, because that's how things become just a little bit awkward and a little bit cringy for the child. Another tip would be validating their feelings. Letting them know that their feelings are valid. It's okay to feel this way. Everyone goes through hard times, and I'm proud of you for being honest with me. Thank you so much for trusting me or opening up in this moment, in this conversation today, right here, right now. But let's break this down a little further with real life scenarios. Let's say your child has been withdrawing from friends, or maybe they're avoiding activities that they normally wouldn't avoid. You might say, lately I've noticed that you haven't been hanging out with any of your friends or participating in basketball, and normally that's your jam. Is there anything that you want to talk about? Is everything okay? You know, I'm here for you anytime you want to talk, and just plant that seed and go head on about your day. Of course, give them time to answer, but just plant the seed. Don't pressure them too much. But if you think about it later on and you want to revisit the conversation you started with Johnny, you can start by revisiting by saying, hey, I just wanted to check in with you again. I'm always here for you. I just want you to know that. Continue on with the day. And let's face it, your child might not respond at first. They might resist, and that's okay. That is completely normal. That's okay. They might shut down. They might get defensive. They might walk away, and that's okay. Stay calm. Stay patient. Don't push too hard. Remember, planting the seed, sometimes that is enough. One of the things you can do is remind your child that seeking help is not a punishment. Finding somebody to talk to and be open with it does not mean something is wrong with you. It means we want to give you tools to potentially help you feel better. Or one of the second things you can do is encourage journaling or drawing if they're resistant about finding someone to talk to in person or online therapy. And last but not least, model vulnerability. Share your own stories with your child and let them know that, hey, I've been through something similar. If you're dealing with anxiety, depression, whatever type of story you want to share with them, to let them know, hey, it's normal. My parent been through this, and now I feel a little bit more comfortable with coming out and telling them what's going on with me or how I've been feeling lately. That is okay. And also mention the resources you used when you were their age to make it less awkward, to let them know it is perfectly fine if you need to find someone to talk to. Perfectly fine. Perfectly fine. Just make sure after you have this conversation with your child, you need to follow through on any and all promises that were made during this conversation. Like, for example, if you guys talked about therapy and you mentioned finding a therapist for them, make sure you actually follow through on that. You can call your insurance company. You can use psychologytoday.com by entering your zip code. You can ask for a referral from their pediatrician or their provider. Make sure you don't drop the ball because they're actually counting on you to do what you said you were going to do. And after this conversation, don't let it be a one and done. Keep checking in with your child. Keep supporting your child. Keep showing up for your child. Celebrate progress no matter how small it may be. Let them know that you're actually looking at what they're doing and you're acknowledging you see them trying. And remember, this is a journey. Healing from mental health challenges involves teamwork between parents, kids, and professionals. And if you need a list of resources, please check down resources that are in the description box. I have listed a few that I use, quite frankly, every day in practice, and I live by those. So make sure you check it out. So to wrap up how to start these conversations with our child about mental health, depression, and anxiety, just know it isn't easy, but it's one that's very rewarding and one that starts that foundation of trust and connection with them on a whole nother level. And they don't have to question where you stand when it comes to that. They don't have to guess that you won't be hip to it because it's something that you don't talk about. You're starting a conversation early, and that's important. Just remember, you're building trust and you're building a foundation for healing. If this video helped you, or if you found it helpful, please give it a thumbs up. And if you know anybody who could actually use the tips and the tricks given to you in these videos, and if you know anybody that might benefit from watching this video, don't hesitate to share it with them. And also hit that bell notification and subscribe so you can be alert next time I upload another video. And thank you guys for watching. I will see you on the next video. Take care.